could you tell me why you signed this letter in the breach and people?
Because I'm more than upset. Because I am caring of my fellow citizens that are suffering, that have had a large burden on themselves since the beginning of this pandemic, and we all know that's the more vulnerable people of our society. And also, I insist to recall also the youth in general. I think that the more the pandemic lasts, the more the youth suffer from it. And so, because as a scientist, I know that this measure is not based on sound science. It's not based on data. We don't really see any significant effect associated with the curfew on social contacts. It's tough to assess and evaluate, but we don't see, if there would be an impact, it would be very small. And as of yesterday, new data were analyzed by the Institut économique de Montréal, and they assess different, with different methods and modeling. They tried to isolate the curfew's effect, and they just didn't see anywhere. They didn't see it anywhere. So I wrote this letter because I'm upset of our government putting in place measures that are more political and punitive rather than effective and based on sound science for sanitary, effects. Where at the same time we know that this curfew and the last one, the last one had some detrimental and harmful effect on vulnerable people and communities, and that the next one will have probably more, because the pandemic has been out there for 2 years now, and the burden is really important. And so I'm thinking of people living on the streets, people using drugs, sex workers, people experiencing violence at home, and the youth, as I mentioned earlier. And we even have data. We don't have that much data for harmful effects. We have a lot of anecdotes from practitioners working with those communities and people, but we have data from the INSPQ showing like the last curfew was associated with an increase in overdose-related deaths from drugs.
Would you mind elaborating a little bit more about how you think that the curfew negatively affects youth?
Yeah, youth. Yeah, well, in general, youth, in general, people need to socialize, but the youth, it's more than a need. It's fundamental to their development, their social development, their identity development, even their brain development, and developing social abilities and personal abilities. And so this is something that's worrying, because I I expect youth to be impacted for a long time, because it's a long time without socialization, and it's not the adults having kids living in homes, large homes, that need to go out or go out at 10 p.m. It's the youth. Youth go out at 10. If we can remember being young, and sometimes they live in homes with parents or many people. So having the chance to go out and see people, even at night, is a way of reducing the impact on the pandemic, but allowing them to have a minimal socialization they need, and they will have anyway, because there's a minimal social contact people need, especially youth. And the curfew doesn't, prevent them from seeing friends. They will just maybe in many cases, sleepover, and then increasing the risks of transmission. So yeah, but we know there's data, and there's a large consensus that the youth population has been the one who saw its substance use increase the most. The mental health problems increase the most, and their economic health being impacted the most. So we already know that. And the fact that we prolonged the curfew, the pandemic and the curfew in this case, will just increase these impacts on youth by many ways. Just not having the possibility to go out, just mentally, just knowing you can't, is already something that can increase anxiety among youth. So there's different ways that how the pandemic can impact youth, or the curfew, pardon me, can impact youth.
Thank you. Say, for example, you were to tell this to Legault, especially the part about, gatherings and how it's essential for mental health in particular. And he gave you some response along the lines of, well, we need to limit gatherings to limit COVID so that we can get back to normal faster. What would you say to something like that?
Well, asking youth to limit contacts for 2 weeks is something they can do, but for 2 years, they cannot. And we know that the spread of COVID outside, in full air, is about 0.1% of the transmission of the COVID. So if you want to, relieve the health system, instead of forcing, because that's what the curfew is doing, instead of forcing people to go into homes in clandestinity, allow them to go out and then reduce the transmission. But I know Legault wouldn't listen to me for several reasons. I'm not his kind of voter. And I know this policy is not based on rational thinking. It's based on electoral thinking.
So the curfew, it's been announced for 3 weeks. Do you fear that there might be this constant renewal where we see
of course
5 month?
Of course it's going to be renewed. We expect to have a lot of hospitalization in the next weeks. I mean, we've played in that movie earlier. The government's going to say, well, we thought that it would improve, but we need to prolong the curfew. And even if a lot of people are now asking to remove the curfew, again, I think it's pleasing the people who's voting for him. The CAQ is not a party that is preoccupied by the vulnerable people. That's not by them they're elected. They got elected on dividing the society, and they'll continue to be reelected that way.
That's a good point. Is there anything, I mean, broadly, you kind of mentioned it affecting marginalized communities. Is there anything maybe you want to mention specifically about how curfew affects it?
Well, maybe I can, because people tend to say, well, people living on the street are exempted from the curfew, so there's no problem. But that's not knowing the field, the reality. Now that there's a curfew, the people living on the street are more visible, and it's not written, on their head that they are exempted. So they have papers, they need to show the police. So they fear contacting the police. They have a negative history of police contacts and profiling. So they just tend to stay in risky situation don't go get services because they just fear encountering the police. Same thing for substance users. I mean, it's same kind of thing. They're not exempted, but some of them need to access supervised injection sites for preventing overdose, and they cannot. They're not allowed. So that is probably related to the increase of cases last year of overdose deaths from drugs. But there's plenty of other, I think, of people being in a house, even with a boyfriend or and being threatened, feel don't feel safe, and they cannot go outside, or just people living domestic violence. We know that there are risky situations, and we tell people to leave the home when it's risky, and those violent situations can happen at any time of the day and night. People living alone also, I'm thinking of them. We say that people can find a family, and that's another problem. Very conventional measures, like based on family unit of society, but some people don't have family, or if their family is their friend, and it's not easy to find one family that wants to see you, so you might be alone. And another thing that's not exactly related to the curfew, but it shows how the government makes its measure for conventional and traditional people only, is people in a couple relationship, in a loving relationship, that don't live together, but where each partner lives in settings with other people. They just can't see each other, and that's something that's also very problematic from a mental health point of view. And that's forcing people to break the measures, to not obey to the measures, and we see it more and more, people getting sick of harsh measures and starting to less observing the measures.
Yeah, that's a good point. I was actually going to ask you about, with all this kind of harsher restricting measures, it almost makes people less motivated to follow the rules.
Of course, yes. Even
Um,
people that were observing them from the beginning.
yeah, 100%. Do you think, with curfew and just kind of increased policing, do you think the government is more having a security approach rather than, and especially with fines and stuff too,
Yeah.
rather than like a public health measure?
Oh yeah, totally. It's a repressive government, and we know that repression doesn't really work. uh, we need education, health promotion, prevention, harm reduction, support, consultations, democracy. That's what we need, not repression. And of course, it's based on security more than public health per se.
Thank you so much. Is there anything I didn't ask that you think is good to consider, or just that you want to share?
Well, I just want to share that I'm really deeply preoccupied by social divisions that the government feeds all the time, and that will stay for a long, long time in our society, more than the pandemic, more than the 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 the, the vaccine pass, and I'm deeply preoccupied by those social divisions currently, and the stigmatization of people, which we know is harmful in terms of strategy, public health strategy. We know that from the HIV epidemic, stigmatizing people is really counterproductive, but the government is doing that all the time.